So the criteria for diagnosing ADHD really comes to two broad categories. The first is inattention. Those are things like children having difficulty staying organized, staying focused, and really having a difficult time staying focused on a task. The other broad category related to ADHD is hyperactivity and impulsivity. These are behaviors related to forgetfulness, difficulty managing their emotions, and any sort of actions and words, blurting, interrupting, and difficulty sitting still. So these are the two broad categories. In addition, ADHD is a childhood disorder, meaning that these symptoms must be present before the age of 12 and cause significant impairment in some domain. We don't have any blood test or medical diagnostic test to determine a diagnosis of ADHD. It really is a clinical process. That means that we use a variety of sources of information and gather information from teachers and caregivers to really determine whether the presence of this disorder is a clinical diagnosis. If you have concerns that your child might be exhibiting symptoms of ADHD, the recommendation is to start a conversation with your pediatrician. This is the first stop, so talking to your child's doctor about your concerns. And if your child's doctor does have concerns that there could be ADHD, consider obtaining a referral to a psychologist to have a comprehensive evaluation completed. So there are certain things parents can do to support children with ADHD in the home. Children with ADHD really do well when there are clear rules and expectations set and reinforced. They also benefit from having consistent routines in the home, things like bedtimes and meal times, etc. Another way to support children with ADHD is to really provide a high level of feedback. So frequent positive praise when they are exhibiting positive behaviors and following those expectations. If there are concerns about your child's behavior or social interactions, behavior therapy is another option to look into, just a way to build up your child's skills in those areas of need. Children with ADHD often are more successful when we have routines in place. This allows for that predictability and that consistency that can be really beneficial for children with ADHD. These routines allow for a child to have more practice with these skills and to build healthy habits that they can take on with them in the future. Children with ADHD often struggle with some of the internal and self-regulation and rely on the environment for some of that regulation. So some of the strategies focus on impacting those environmental variables, such as working with parents and coaching parents of how to manage children with ADHD. Oftentimes, kids with ADHD don't respond in the same ways to motivators and consequences, and so it requires a more creative approach to parenting at times. Older children might be able to learn to cope with ADHD through learning specific skills. Emotion regulation is often a challenge in ADHD, and so learning how to cope with those challenges and learn explicit coping skills of how to keep organized and really managing some of those emotions can be helpful. So just because a child has a diagnosis of ADHD does not mean they will be struggling in school. But some characteristics of ADHD, such as those executive functioning skills, we call them, related to planning and organizing and achieving goals, can be impacted in the school setting. If your child is struggling with these things in school, I recommend talking to your school staff and seeing if there are additional supports and accommodations that can help your child be more successful. Children with ADHD may struggle in school depending on how these characteristics impact them. And if they are struggling, it's important to talk to your child's teacher and other school staff to see if there are additional supports needed. Some of the most obvious symptoms of ADHD you might notice in the classroom are those more hyperactive and impulsive behaviors. Those are the kiddos who are really struggling staying seated, who are blurting out, interrupting, and having a difficult time managing their emotions. But as children get older, some of the less noticeable symptoms might be things like staying organized with their schoolwork, getting their assignments turned in on time, and really keeping focused on the tasks. For parents who are looking for more information about ADHD in their children, please check out our website at boystownhospital.org.